to see your first slide.
I think we're in business now. There we go. Okay, thank you. So public involvement in research. This has been defined as research that is being carried out with or by members of the public rather than to, about, or for them. And the role and presence of public involvement in health research is developing internationally, and it's particularly evolved over the last 20 years in the UK, to the point that public involvement is now embedded in NHS and NIHR policies, and also in the culture of health and social care research. However, public involvement hasn't been so explicitly prominent in health economics research, and nor has there been a focus on specific approaches for involving members of the public in health economics research. However, this is beginning to change. And what I'd like to do in the next 10 minutes or so is to talk about some of the expectations regarding public involvement in research applications, and particularly applications to NIHR, to talk about public involvement in the particular context of health economics research, and also give you a few examples. So there's much guidance literature on public involvement standards. So for example, the UK standards for public involvement was developed by a UK-wide partnership in terms of health and social care research organisations. And the aim of that was to improve the quality and consistency of public involvement in research. The GRIP checklists, which are tools for improving the reporting of patient and public involvement in research, are an excellent resource. And also available for support is the NIHR Centre for Engagement and Dissemination. Now, this is really the successor to Involve, which was the organisation that really pushed forward public involvement in health and social care research over a number of years. And the Centre for Engagement and Dissemination produced a number of really practical documents about public involvement, such as advice on paying public contributors. There's been a recent development with NIHR, which is that applications to NIHR now require a PPI lead. And this is someone who is named on the application who has the particular role of managing and steering public involvement for that study. And this is a role that's additional to the role of public contributors. So if you're not sure where to start with public involvement, or you'd like some support, a really helpful starting point might be your local NIHR Research Design Service. Part of their remit is to provide advice on public involvement. They can offer links to networks of public contributors, networks of potential PPI leads, and also they offer a public involvement fund, which provides small pots of funding for really kick-starting public involvement in the early stages of application development. So what I'd like to move on to now is public involvement in health economics research more specifically. This is where there's been less guidance and fewer particular examples, but this is starting to change with some of the exciting work around public involvement and modelling, which Sophie is going to come on to speak about, and also a recent series of papers published in The Patient. What I'd like to do is talk about some of our experiences. Over the last 8 years or so, I've been working with people with multiple sclerosis to develop a variety of health economics research studies. And as part of this, we formed the Health Economics and MS, or HEMS, PPI group. And before going any further, I should acknowledge my main collaborators here, who are Lynn Tatnall, who is someone who has MS, Liz Goodwin, a health economist, and Kate Boddy, who's been the PPI facilitator, who's really helped drive this work. And together, what we wanted to do was reflect on our experiences. And we've drawn up a set of principles for considering public involvement in health economics research. And really the kind of aim of these is just to provide some ways of thinking for health economists who are starting out in public involvement. So these are the principles which we've referred to as the Pax Principles. And I'll just take a minute or so just to kind of take you through these. The first of them is planning. And a really useful starting point here may be what information is needed for this research project that can be best or only obtained from members of the public. And thinking through answers to this question can enable planning in terms of involvement activities, what the outputs might be from these involvement activities, and how this involvement will then guide and form the shape of the research. It's also helpful to plan how to convey health economics information. This was something that Elsa touched on in her presentation. One of the barriers or perceived barriers to public involvement in health economics research has been that some of the concepts and some of the research methods can be considered as technical or inaccessible. But what's key with public involvement is the descriptions given don't need to be technically correct. Rather, they need to convey sufficient information for members of the public to understand the purpose of the research and to be able to engage with it meaningfully. The second of the Pax Principles, approach selection. Here we'd suggest considering task-based approaches. Discussion-based approaches are fantastic for generating broad insights and also for uncovering unknown unknowns. So those things that really come out of left field that you just haven't considered at all. Alongside this, task-based approaches can be helpful too, because they can help to reveal known unknowns. And this is useful for some of the more prescriptive health economics techniques where some of our parameters are fixed and are not amenable or open to change by public involvement. An example here is that we worked with our colleagues in the HEMS group, and we worked with them to set attributes, levels, and the wording for a discrete choice experiment of factors affecting the employment of people with MS. The third of the Pax Principles, continuous involvement. And here there's the need to involve members of the public in the development of public involvement in health economics research. And the example I have here is an instance where I really came a cropper. What we've done was designed a task to facilitate the involvement of people with MS in identifying implausible health states. And this was to inform a health state valuation survey in the design of a condition-specific preference-based measure. But what I neglected to do was ask anyone with MS to work with us on the development of the task. And really what ended up happening was we had a PPI session where I ended up talking jargon gibberish, and really no one understood what was being asked of them. It was a real nasty learning curve for me, that one. And then the final two of the Pax Principles, team building and sensitivity. Building a team over time can help to create a shared sense of ownership and trust, and also the potential for public contributors to be advocates for the value of health economics research. And this building over time seems particularly important as health economics research has been perceived as impersonal, as far removed from real patient experience, and also given the controversies sometimes around decisions made by NICE and the role of the work of health economists in that. So I have come across the starting point of, well, health economics, it's all about cutting costs, isn't it? And in our experience, such starting perceptions are really best addressed clearly, openly, honestly, but also sensitively. Okay, so in the last minute or so, I'd just like to give you another few examples of public involvement in health economics research from my experience. Usual practice, or what's more sort of commonplace in terms of public involvement in relation to health economics research, are the examples of clinical trials which have an inbuilt economic evaluation. And it's very common for public contributors to be members of a trial management group or a patient advisory group. Also commonly to comment on patient information sheets, lay research summaries and outcome measures. And that's great and is needed and is a really legitimate, important role for public contributors, but public involvement need not end, nor should it end there. There are other possibilities. And just as a few examples, public contributors can help to interpret study findings and their implications. They may wish to write lay summaries. They can help inform the design of new measures and questionnaires. So, for example, we worked with the HEMS group to identify illness-related events and to specify them in a form suitable for use in assessing the responsiveness of preference-based measures. Okay. Members of the public can help to design interview schedules for qualitative health economics research, or for example, cognitive interviews. They can help to answer what to include in resource use questionnaires for particular patient groups beyond the core resources that might ordinarily be included in those questionnaires. And really the kind of the epitome or what we'd hope to aim for is that public contributors, members of the public, have a role in setting what research questions we should be addressing. So, for example, my colleague Liz Goodwin, she held a fellowship from the MS Society, and one of her work streams was about factors affecting the employment of people with MS, and that work stream was entirely decided upon by a group of people with multiple sclerosis. Okay, onto the final slide, and I'd like to just go sort of full circle back to thinking about your application as a PI. Just some of the things that will be expected for that application. For the application, you will need to describe what public involvement has informed the application, what you've done, why you did it, what you found out, and then what difference that public involvement has made to the application, what you've changed or what you've altered in terms of what you will do and how you will do it. And thirdly, there's also the need to describe what public involvement is intended to form part of the research study. Thank you.
Annie, thank you very much. That was a great talk. There's lots of pointers there for